Metropolis. The SARS-CoV-2 virus infection, also known as COVID-19, is spreading every day like a fire across the globe. With the similarity of COVID-19 infection symptoms with many common ailments, specific diagnosis is crucial for further management and prevention of infection spread. Different types of tests are available for the detection of COVID-19 virus infection. Hence, a lot of confusion exists among people about the right choice of tests. Broadly, there are two types of recommended tests for the COVID-19 virus. One is a direct test to diagnose the viral infection, namely RT PCR test, while the other test is an indirect antibody test for checking immunity and surveillance. What is COVID-19 RT PCR test? The COVID-19 RT PCR test is a test for detecting genetic material from SARS-CoV-2 in swabs taken from the nose or mouth of the individuals suspected of COVID-19 infection. How does RT PCR work? COVID-19 is a virus containing the only RNA as genetic material. In RT PCR method, scientists convert the viral RNA to DNA by a process called reverse transcription. A specific part of the transcribed viral DNA is amplified thousands of times to confirm the presence of virus accurately. Why to choose real-time RT-PCR? RT-PCR is considered as the gold standard for diagnosing coronavirus. It is one of the fastest and most accurate laboratory methods for the detection of COVID-19 virus. The RT-PCR test is highly specific and a positive test result is highly confirmatory as dual tests are done before reporting, first for screening and secondly for confirmation. However, there is a chance of false negative result, and a single negative test does not exclude COVID-19 infection. A real-time RT-PCR test takes approximately 3 to 4 hours for diagnosis and results can be given on the same day. What is antibody test? Antibody test is a test conducted on a person's blood sample to detect the presence of antibodies developed in the body against COVID-19 virus. The positive test results indicate exposure of the person to the virus. It is also an indicator of developed immunity in the body against the virus. Limitation of antibody tests. Antibody test is not used for diagnosis of COVID-19 infection. Experts say that antibody test can be misleading due to false negative results if done in the first week of the coronavirus exposure. Other available tests for COVID-19. There is another available test named Rapid Antigen test (RAT) to detect specific viral proteins, antigens, present on the virus's surface from a sample taken from the nose. Although the test results are quick within 15 to 30 minutes, RAT has low sensitivity and produces false negative results most of the time and is not widely accepted for clinical diagnosis of COVID-19 infection. Things to keep in mind. 1. If you have symptoms similar to COVID-19 infection, RT-PCR test is the test for diagnosis. 2. If you want to know about your developed immunity or exposure, you can go for antibody test. 3. If you want to join office, you can get yourself tested with RT-PCR and antibody tests. 4. If you want to rule out COVID infection before or after a travel out of your city or town, RT-PCR test is preferred. COVID-19 tests can be done at hospitals, clinics or laboratories. The cost for your COVID-19 tests will likely vary depending on location. If you are suffering from any symptoms of COVID-19 viral infection like fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea, talk to your nearest doctor and get yourself tested. Brought to you by Metropolis.